to talking women's health this morning. And if you are a couple and you're trying to start a family and you're having a tough time, or maybe that couple that's just happy being a couple, we have women's health expert Dr. Angela DeRosa joining us this morning. We're talking about contraception, infertility issues, and solutions. We're covering the gamut, aren't we?
Oh, we've got a whole bunch to talk about, don't we?
We sure do. Starting with the contraceptions, what do we have available right now?
So it's important that if you don't want to have children, that you plan accordingly, and also that you use the birth control, whatever device it is, that effectively, and some are more reliable than others. So if you want to keep the patient in the mix and making sure, as long as they're compliant and that they can be good with taking medication, certainly birth control options are the most common. And you really need to be cautious in what type of birth control pills you're taking, because not are all equal, and some people, doctors will give them just any one sample out of their closet. But if they're low estrogen pills, they can be fairly harmful from a metabolic standpoint for women. But again, that can get into a lot of nuances, but most common, effective about 90–95% of the time. But I've had patients who have gotten pregnant on birth control pills because they forgot to take them.
Oh boy.
And you really need to make sure you're taking them around the same time every day. But the compliance is fairly high, but again, there's room for error.
So if your doctor says, hey, try these, what's a key question that you should ask them before you just go ahead and just start popping?
First off, you want to understand the ratio of the drugs that are in there. All birth control pills typically have estrogen and progesterone in them. And the low estrogen pills, everyone thinks is wonderful because they assume estrogen is bad for women. But in young women, we need estrogen. And most women need estrogen even as we get older. And if you have a high progesterone pill with a low estrogen pill, progesterone is the PMS hormone. It leads to weight gain, bloating. It will cause high cholesterol. It can increase your metabolic risk for cardiovascular disease.
So do your research.
So do your research. Make sure they're not just doling out any pill to you. It's important. Also, birth control pills will cause low testosterone in all women. You need to watch for those symptoms.
Gotta have the balance.
Absolutely.
What else do you have here?
So one of the most common things we like to write for in our practice, I don't know if you can see this, is a Nuva ring. And it's really nice because you basically, kind of like a taco, you would insert it into the vagina, and once it's in there, it kind of spring loads and it pops right into place.
Really?
You put it in for 3 weeks, and then after the 4th week, the patient would pull it out, and then they would have their period. And the good news about this is you don't have to remember anything for 3 weeks. With our cell phones, you can just alarm it, time to pull it out, time to put it back in.
I know there's an app like, hey, your period's about to happen, you know, thanks for telling me.
So just remember to take this ring out. And what's lovely about it is you can forget about it, but also these typically don't cause the testosterone deficiency effects like the birth control pills. Also, oral pills, they process through the liver, kick out clotting factors, increase clotting risk. These do not, because they avoid the liver processing. It goes right into the bloodstream. Love the Nuva ring.
You like those. And if you are a smoker or you drink lots of alcohol, you have to watch the birth control pills versus those.
Correct.
Very interesting.
The other thing is, one of the things that we'd like to see more of are these IUDs, which we place in the office. So these get inserted into the uterus, and those last about 5 years. You can take it out any time if you choose to get pregnant before that, but they provide contraception for 5 years. You avoid the clotting risk. You can still have your ovaries work, because all it's doing is creating a hostile environment in the uterus. So the ovaries work, you get proper hormones being produced out of your ovaries. Love the IUD.
Now, once you take that out and a couple is like, okay, it's time to try to start for a family here, will it happen right away, or does that take some time?
Well, the nice thing about the IUD is the ovaries are consistently working. All it's doing is creating that hostile environment, so the ovaries are already ready to go. You remove the IUD, within a few months, the estrogen that's in your body will start to grow the endometrial or the uterine lining again, and you should be good to go probably within 2 to 3, 4 months at most.
Wow. Challenges that couples are facing these days. It just seems more and more couples are having such a tough time getting pregnant. What's going on?
Well, a lot of it is we are delaying pregnancy till our 30s and 40s. Biologically, Mother Nature wants us to have our babies in our 20s. That's when we're most healthy. Also, I'm seeing an earlier onset of menopause in women, so I think there's a lot of environmental exposures. So we really want to time that. If you really want to have children, think about it earlier. So that's part of the problem. The other thing I'm seeing, a lot of women are developing hypothyroidism earlier. Extreme workout folks, they shut down their ovaries when they work out excessively too. So you have to look at hormone balancing to make sure that the fertility. But when you look at fertility in patients and couples, A third of the time it's a male issue, so it's problems with sperm, so
Look
they're not off the hook.
Both, exactly, it's not just the
A
gals.
third of the time it's the women, and most often hypothyroidism is the common cause, or endometriosis. A third of the time we have no idea what's causing the infertility. But to give yourself the best odds, start young, and if you can't do that for some reason, think about saving some eggs and putting them away in cryobanks.
That's great information.
Yep.
At what point, here you are, you're trying to start your family, at what point do you have that talk, I think we need to see a specialist?
When you've been, the technical terms is if you've gone longer than a year and you've not been able to get pregnant, you've got an infertility issue. I'm encouraging women, especially if you're in your 30s, you may want to cut that back to 6 months. At the very least, get a good look at your thyroid, look at prolactin levels, because there's a benign tumor in the brain that can mess up your ability to get pregnant. Make sure your vitamins are well balanced. Take good care of yourself. Do not smoke. Being overweight will often lead to what's called insulin resistance, which leads to infertility.
Diet, exercise, exactly. Just so if
Yep.
you're healthy, if both of you are healthy, then your chances of starting your family are more successful.
Exactly. So give yourself 6 months. If things aren't looking good, go talk to somebody.
Great information. Thank you so much.
You're welcome.
There you go. We'll be right back with more of the Morning Scramble.